Alright, so this is part 2 of the digestive tract. We're going to go ahead and get started with this and see just how well we do. So this is part 2 of the digestive tract, our digestive system. We're going to start here after we've just finished with the upper digestive tract. So let's start with the stomach at this portion. The stomach looks kind of cool. It has actually different layers, and those different layers, just like an onion, they serve for protection, but they have different purposes. And the stomach is this really big muscle, and as you can see, the muscle layers are actually going in different directions, and that's to help with the muscular contraction of breaking down the food as it's trying to start the digestion process and go into that absorption phase once it leaves the stomach, going into the small intestines. So this is a great little picture showing you all the different portions of the stomach. You have the esophagus going into the cardiac region of the stomach, where the very top part of the stomach is actually called the fundus. It's that rounded part. And when we get to the reproductive system, there's actually the rounded part of the uterus. It's actually called the fundus. But then you get to the bottom portion of the stomach itself, and you have the pyloric region, and then the duodenum is where it actually curves around and goes into the small intestine. This is a good look of the inside of the stomach. It has all these little rugae folds, which all that helps with the breaking down of things and muscular contractions, so it starts to break down those foods. And then this is even a cool little picture where it shows you all of those little nodules and folds from the rugae. So it's really awesome, and it also shows you there the mucosa, so that everything inside is a mucous membrane. Okay, so now we need to move into the lower digestive tract, and this is pretty cool because it's very long, and we don't really think about how long our large intestines are, but let's look at this. So the large and the small intestines all together, they're between 24.5 to 28 feet long. Holy moly, how does all that fold up into our stomach, and into our abdomen? But it does. So the small intestine is about 20 to 23 feet, and remember, that's where your digestion and absorption is really going to be taking place. And then the large intestine, this is a little bit larger. Remember how in that picture it was bigger. However, it is shorter in length. You can see it's about only maybe 5 foot, and this is where we're actually moving that waste down to be eliminated. Okay, so we are going to look at some of these combining forms that you probably see some that are already very familiar, especially this one here that says appendo or appendico. That's talking about the appendix. Remember I said there's a variform appendix, that little hanging down thing at the beginning of the large intestines. You might have heard somebody say, I've had my appendix removed. And that procedure is called an appendectomy. Remember, ectomy is that surgical removal of. So some of that stuff may seem pretty familiar. Even the diverticulo. Some people have diverticulitis. They might have colitis, so that colo looks familiar. Here's another good picture of the large intestine, so you can see where I was talking about the variform appendix. Then you have the ascending colon, transverse, descending, sigmoid, here where it's taking that little sharp S turn from the descending. Then you get down to the rectum, and then the anus where that waste product is removed. So what are the big functions of large intestine? So here we're going to be absorbing the water, the sodium, and the chloride. Those are big chemicals that we need to absorb. They're actually necessary for us to have. It also secretes mucus to keep everything nice and lubricated. There are bacteria within our intestines, and that's normal flora, so it needs to be there. But if we introduce other bacteria, that's when we start to see sickness. And a lot of times, if you've ever taken an antibiotic, and maybe after you've taken the antibiotic, or as you're finishing it, or maybe even right when you start to take it, you'll get a bout of diarrhea. And that's because some of the purpose of that is to break away all the bacteria that's in the digestive tract and the mucosa, so we can make room for the healthy stuff to start growing there. And then of course the last one is to form and expel waste and feces. So let's talk about some of these accessory organs of the digestive tract. You have the liver, the gallbladder, the pancreas, and the salivary glands. So these big structures have a purpose. You know, if we say accessory, what are accessories? Well, if you think about clothing, accessories would be a purse, a belt, earrings, necklace, cufflinks, those kinds of things. They're necessary to complete the outfit, if you will. Well, the accessory organs for the digestive tract are necessary in order to make sure that the digestive system is properly functioning. So again, here are some of the combining forms for those accessory organs we just named. Let's talk about the functions of the liver. Now, I do not eat liver. I do not care for it. I don't even care for the smell because I know what it does. But I've also tasted it. Yes, don't think that I'm being prejudiced. Yes, I have tasted it. It don't taste good. But let's see, what are these functions? And if you eat liver and enjoy it, I'm sorry if this turns you off. But the liver produces bile, and that bile is going to be stored in the gallbladder. The liver also is important for lipid metabolism. Remember, lipids are fats. It also helps with the synthesis of plasma proteins. If you've ever looked at liver, like a cow liver, it's very dark, and when you cut into it, it is very vascular, and that's because it does these kind of things. It's also involved with the regulation of blood glucose. It's kind of like a huge filter, in my opinion, and here the slide even tells you that it filters blood. It breaks down a lot of toxic compounds. It stores iron and other vitamins, and that's why a lot of times you'll hear, well, our liver is very healthy. It has a lot of iron in it, and it does. But it also secretes the bile pigments from the breakdown of hemoglobin. Now remember, hemoglobin was really important for our red blood cells. So that was the part that carried the oxygen for us. So this is pretty important with filtration of blood. You got to think about that. And then also our liver is responsible for excreting hormones and cholesterol. So here's some of the terms that you're going to hear alongside with the liver and the gallbladder. And here's another good look at all of those accessory organs. The liver is in the right upper quadrant of the abdomen, whereas the stomach is tucked underneath, and it's on the left side. You also have this cool guy in the back here. He is called the pancreas. He is probably one of my least favorite organs because I like to call it the bipolar organ. For diabetic patients, it either works way too much or not enough at all. So the functions of the pancreas, they help with digestion, and they also produce hormones. There are enzymes that are produced through the pancreas called amylase and lipase. Then it also works with the secretion of that glucose. So we have hypoglycemia. Remember, hypo is low, hyper is high. So we've got those conditions where there's low sugar, and then the emia, remember, it meant blood. So this is low blood sugar, and this is high blood sugar. And then it also is regulating the production of glucagon. Remember, glucose is sugar, and insulin. Okay? So let's look a little bit further here and talk about some of the diagnostic tests and procedures that our patients can have within the digestive tract. So some of the easier things we want to do that are less invasive, we want to do those 4 things that we talked about with a physical exam. We want to do inspection, looking, auscultation, listening, percussion, meaning tapping like a drum, and then palpation, feeling. Alright, then there's also an abdominal x-ray and an endoscopy. There's also fluoroscopy, where we're introducing a contrast medium to help us see with an x-ray what everything looks like within our digestive tract. And it's really, really cool because you can see a lot of really cool things once you introduce that contrast medium, and that's included with fluoroscopy, esophagograms, barium swallows, even a barium enema. There's also computed tomography, which is CT, what we typically say is a CAT scan. And then I'm not going to keep reading all those to you because you can read that, but here is a great picture of an esophagogastroduodenoscopy. So remember, that's that big word that I wrote on the board at the beginning of the semester that basically breaks down to the procedure of looking down with a scope at the esophagus. That's the esophago. Gastro is stomach, good. Then duodenum, that's the last part of the stomach. So this is the esophagogastroduodenoscopy. A lot of times you'll see that abbreviated EGD. A lot easier to say as well. So that's a good picture, so we can see that the doctor takes the scope and looks down into the stomach towards the lower end where that duodenum is. So what are we doing with a colonoscopy? Well, we're actually going up through the rectum and looking through the large intestines. So with those procedures, we can look at how the tissue looks. If there's things like polyps, like you see over here in picture C, we can remove those polyps and send those off to the laboratory to see if they're cancerous or not. This is a great picture using contrast medium. So this little teardrop looking portion is the gallbladder. And inside the gallbladder, those little dots there are gallstones. So with this procedure, it's a cholecystography. This is the process of looking at the cholecysto, which is the gallbladder. And with this x-ray, we use contrast medium, so all this is brightened. We can see it better. We also can use ultrasound, which is that sonography, different types of nuclear testing, which is done through x-ray as well. Some lab tests. We can draw some blood. We can look at liver function tests, or LFTs, looking at serum bilirubin. Remember, when we have patients that begin to look jaundice, that's because there's too much bilirubin in their blood and it's not being able to be broken down. We'll see that a lot of times with our patients that have liver failure. Sometimes you'll see that with babies when they're first born, but that typically goes away pretty quickly when we give them some exposure to UV rays. Also, you can see all these other types of lab tests, the SGOT, SGPT, ALT, AST. These are all looking at the digestive tract, accessory and regular organs, seeing how they're working. Some other tests, stool samples. We're looking for occult blood. Occult means hidden. We would do that guaiac test. That's really easy. That's something we can do in the office, and it's typically takes 2 seconds, not a big deal. So now let's look at some of the pathologies. Remember, pathologies, we're talking about problems that patients will have with this particular system. So pathologies for the digestive tract, you are going to see anorexia, often termed anorexia nervosa. You probably had a picture just to pop up in your head of a very, very skinny individual that looks like a skeleton with some skin. That is typical for us to picture, but that is not the definition of anorexia. Remember, A and an mean no, not, or without. So the orexia is appetite. So with this particular situation, the patient just doesn't have any appetite. So you might see that anorexia is a diagnosis that a patient may have, and they are very healthy, but it just means they've gone through a period of time where they did not have an appetite. And that's common when you have different types of disease processes or illnesses like the stomach flu. You don't want to eat, so you have a little anorexia. Bulimia, this is another one that you've probably heard of. This is that condition where patients voluntarily vomit to eliminate all the food that they have in their stomach. With anorexia and bulimia, we really worry about not just the medical side of this particular disease, but the psychological side. So don't ever let this patient miss the whole treatment, not just what you're treating there in the office for the physical conditions, but they need to be seeing a therapist so they can talk about their problems. And it's an ongoing issue that they have to deal with, okay? You also see a term here, emesis. That is our medical term for vomiting. So sometimes you might have a hyperemesis. Remember, hyper is excessive. And then if you see hematemesis, what did hemat stand for? That's right, blood. So sometimes patients may vomit blood. We also may see that in their stool, which is called hematcasia. I think that was on the previous, yes, right there, hematcasia. So those are very important for us to note when our patients come in saying they have this. So let's go to the opposite end of the spectrum, from anorexia and bulimia to obesity. This is going to cause problems as well. So believe it or not, you are going to have a lot of your patients who are obese or morbidly obese, and they actually suffer from malnourishment, but it's because they're not eating the right foods. They're eating more of those carbohydrates and fats that do not give them all of the essentials that they need. So we oftentimes will see malnourishment in obesity. Polydipsia, that's an excessive thirst, and we typically note that that's one of the symptoms with diabetes. So you have diabetes type 1 and type 2. Type 1 is the form that patients are born with, and they are insulin dependent. And type 2 is the type that most of us develop into having once we get into our 30s, 40s, 50s, maybe even 60s. And this is because of how our diet has started affecting us, or maybe even genetics. It's kind of caught up with us. Every person in our family's got diabetes. We were born without it, but oh dear, here it comes when we get into our middle age time. So those are some of the things that we typically see with diabetes is polydipsia, polyuria, which means they're excessively urinating, even nocturia, which means they're getting up at night to have to go urinate. Okay, so some of the upper GI tract pathologies that we might run across, one of those is very simply the herpes simplex virus, those fever blisters. You also may see canker sores, which are completely different. Those are actually on the gums, and as you may imagine, that could cause someone to have some anorexia. You also may see some candida of the mouth, which is yeast. That's very common with our diabetic patients. Okay, so the chelosis is also a condition that you will see with some of your patients when they have a vitamin deficiency, and that tells us that we need to really look at ways to help them with their dietary plans. Find out what they're commonly eating and see if we can help add some vitamins through vegetables and fruits to help balance that out. Okay, this is the leukoplakia, where you see the remember the leuko is the white, So you see white plaques here in the gums and in the cheeks, and that typically tells us that there's some things going on too. Temporomandibular joint pain, which is TMJ, that often causes a lot of dental problems where we will see patients have some malnourishment because they're unable to eat anything but soft foods. Cleft palate, this is cleft lip, and then cleft palate, of course, would extend into the oral cavity, into the palate, which is the upper portion of the roof of the mouth, if you will. That obviously it's not easy to look at, and it's a cosmetic thing that we would need to fix, but more physically, this is a problem for our patient, especially these babies, because they can't suckle on a bottle or the mom's breast in order to get nourishment. So this causes a problem from the get-go, and we try to get those corrected as soon as possible. Then it also comes to play with speech. It typically will cause our patients to have speech problems, so we worry about that as well. Okay, so I'm going to stop right there, and we'll pick up on the next lecture.